So what do you do when you have an injury? What's the first thing you should do? Let's say you're playing basketball, you roll an ankle. You're out playing with your kids or playing baseball and you threw out your shoulder. Okay, this is an acute injury. You're going to get swelling, inflammation. Now, inflammation, contrary, we always think inflammation is bad. Inflammation is the first step to healing. So, do you want to drive out all the inflammation? The answer would be no. You don't want to drive out all the inflammation when you're injured because that's going to help you heal. It's going to help get you to where you can go to stage 2 in the healing process. So, what do? First thing you want to do is you want to get some ice on there, and you do want to take some ibuprofen for pain and from keeping the inflammation and the swelling from getting out of control. Now, you want to do that for just a few days. With ice and heat, typically you want to do ice with initial injury onset. Now, I'm going to have a little bit of a caveat here in that I like ice on the extremities, meaning ice on the shoulder, elbow, hands, wrists, ankles, hips, knees, that kind of thing. Ice works really well because you get swelling and it doesn't have room to expand. So you want to get that swelling down. Now, with the back can be a little different monster. I actually typically recommend heat because with the back, you're usually getting a lot of muscle spasms with that. So I would recommend heat with that if you don't have swelling. If you're having swelling and a lot of pain and you try heat and it doesn't work, then you jump to ice. Now, a really good treatment is ice, heat, ice, 15 minutes each. Now, again, not the extremities and not when it's acute. It's more chronic or it's been over 4 to 5 days, then icy ice is going to be a better option. But that's how I attack an initial injury. And then I start moving the muscles, gentle stretching, and moving the joints, gentle joint movement. And I can show you some of those later. But that is where I start. Ice, heat, ice. I take that back. Ice, first go to, if you're ever in doubt, ice it out. Then go to more of a, use a little bit of ibuprofen and start gently using the muscles, moving the joints with intolerance. Keep it moving, and movement is motion, is lotion, is life. So keep that going, get the inflammation and the heat and the swelling down. And then after a few days, then you can take a different approach as far as how aggressive you can get with stretching and exercise.